Okay, so the teeth, altogether, the teeth are known as dentition. Okay, so dentition is all the teeth. Okay, what is exposed and that we actually see is the crown of the tooth. And where it gets narrower and goes into the gum is actually the neck. Okay, teeth, and you have one or more roots, and that's what's going to anchor it into the jaw and keep it in there. Okay, now the periodontal ligament is what's going to keep the tooth in the jawbone tightly. Okay, now remember from Bio 103 that gummosis is that type of joint that doesn't really move very much. So it's the roots of the tooth into the dental alveoli, which are the holes in the jaw, being held in there by the periodontal ligament. Okay, now anatomy of a molar. So if we look at this, dentin is what the tooth is mainly made out of. Okay, so this kind of tan area here, all of this is dentin. It's kind of like bone, but it's harder than bone. Okay, now on the surface of the dentin, you're going to find enamel, and the enamel is composed of calcium phosphate crystals, which is considered the hardest substance in your body. Okay, so it's really, the enamel is supposed to be really, really tough, although we managed to destroy it. Okay, now the pulp cavity is in the middle of the tooth, and that's where we're going to have connective tissue and the pulp. So we have the blood vessels and the nerves are in there. Okay, so now the root canal, okay, is this canal that's going to go down into the roots, and it's going to be where the pulp continues down in. So the blood vessels and nerves will pass through this root canal, and then they'll go to a chamber, or I guess a canal in the jawbone where they're connected. I hope that makes sense. Okay, so when they do a root canal at the dentist, okay, they're going to numb you up, and the idea is they're going in there and they're pulling out all of this living matter of the tooth, and they're just leaving the shell, what's not alive. Okay, the cementum, it goes around the root, okay, and it helps hold the tooth in there. Okay, so somehow I didn't even see, I missed this slide totally. Okay, so we have 20 deciduous teeth. They normally erupt between 6 and 30 months. Okay, so deciduous, these are your baby teeth. Okay, so the baby teeth fall out, and we end up with 32 permanent teeth. Okay, usually the ones in the front, the anterior placed teeth appear first, and the last teeth that we get, the wisdom teeth, don't occur until late teens or 20s, and our mouth is maybe too small for them, so they can become impacted. Okay, so incisors are in the very front, and they're used for slicing food. Canines are for ripping and tearing food. Premolars are behind the canines, okay, and they're for crushing and grinding. And then molars are for crushing and grinding. Okay, the gingiva, that's the gums. Okay, so if somebody has gingivitis, they have inflammation of the gums. Okay, now the pharynx. Okay, so the pharynx we talked about in the respiratory system, so we're not going to talk about it too much here. It's skeletal muscle. It has a longitudinal deep layer and a superficial layer that's circular. Okay, it has 3 sets of constrictors. Okay, so it's got a superior constrictor. So constrictor is just a circular muscle, a middle, and an inferior. Okay, now the esophagus, it's a straight muscular tube. It's going to take us from the pharynx down to the stomach and down to the cardiac stomach. So they say 25 to 30 centimeters long, which is about 12 inches. So it's about 12 inches long. It's made out of non-keratinized stratified squamous. Okay, so stratified squamous is always around when we might have friction. Okay, because the layers can slough off. Okay, now this is important. The top part is skeletal muscle, and the bottom part is smooth muscle. So we have voluntary control over the top part, the superior part, and involuntary over the lower part. Okay, now where the esophagus passes through the diaphragm is called the esophageal hiatus. Okay, now the idea is the inferior pharyngeal constrictor is going to keep air from going down into the esophagus. Okay, now we have an inferior esophageal sphincter whose job is to let food into the stomach and keep food in stomach. Okay, now two disorders here. One is a hiatal hernia. So that's a weakness in the diaphragm where the esophagus goes through. Okay, so it gets weak there and they can go in and repair it. Okay, the other one is GERD, which is gastroesophageal reflux. So GERD is when the inferior esophageal sphincter can't do its job. Okay, now swallowing. Okay, so swallowing, it's really pretty straightforward, but there are a couple things that you need to be aware of how it works. Okay, so the swallowing centers in the medulla oblongata. Okay, so if someone's brain damaged before or has a traumatic brain injury, they're going to double check and make sure that the swallowing center is working before they let you eat solid food. Okay, so the first phase is voluntary. Okay, so the food goes in, it's mixed with the saliva, and the bolus is pushed back and up to the oral cavity. So it's pushed back here. Okay, and the tongue is what does that. Okay, then what's going to happen is pharyngeal phase. So the pharyngeal's over here. So this phase is important because it's going to keep the food from going into the trachea and out of your nose. Okay, so basically what's happening is the bolus enters the oropharynx. Okay, the soft palate and the uvula rise. Okay, so they rise and they close off the nasopharynx, so nothing can go up there. The larynx rises, the epiglottis closes over the larynx, so no food goes into the trachea. So we're just trying to push it down into the esophagus. Okay, and then for the esophageal, which should be number 3 here, okay, it's involuntary, and what's going to happen is we're going to have peristalsis. So the rings of the esophagus we're going to constrict and push. So like squeeze and push it down through until it enters the stomach. And so the interior esophageal sphincter will open. Okay, so 3 steps: voluntary, pharyngeal, esophageal.